Welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and I am at the Chicago Midwinter meeting in Chicago. And today I have the pleasure of speaking with an individual who I've known for a few years, Dr. Tom Dudney. He is just an asset to the dental community, and it's a privilege to have you on the show today, Dr. Dudney.
Thank you, Kelly. The privilege is mine. So I'm honored to be here.
Oh, thank you. Well, we were just talking about the show and just words of advice, and we were talking about it's hard to fit all of that in 30 minutes. So you guys know I always start with a question and we go from there about why dentistry, Tom, for you.
Okay.
Tell me why.
Yeah, it's an interesting story. And it kind of, if you go way back, I always felt like dentists, I have no dentist in my family. So, but my family dentist always seemed like a respected person. And I had a friend that was, his dad was a doctor. And a physician, medical doctor, and he was always, Jeff and Chad, you have to cut that out. They're harassing me out there.
Oh,
and so
no, we're going to leave that then. It'll be fun.
He was a very close friend, and his father was always getting called out of the house at night, on emergencies and things like that. So I felt like a doctor would be a very respected person in the community, and they lived in nice houses and that kind of stuff. So I had no idea about dentistry other than, going to my family dentist. But I decided dentistry is better because they don't get called out at night. And that's how it started. It was just that one little seed, and it kind of grew from there. And so sure enough, all the way through, I made pretty good grades, and I got into pre-dentistry, and probably wouldn't be a dentist today, except that when I got away to college, I started finding out how much fun it could be, and my grades kind of suffered a little bit. And I remember they had counselors, like guidance counselors, and I remember after my first year, he called me in. I see you're in pre-dentistry. I said, yes, sir. And he says, well, I think you should change to another curriculum. And I said, oh, really? Why is that? He said, well, because with your grades, you'll never get into any dental school.
Okay, intervention.
So it was the best thing that could have happened to me, because I just made a complete change. And I said, okay, I don't like to be telling me I can't do something. So I set out to prove that, he was wrong. And I did manage to get my grades up enough to get accepted to dental school. Now today, it's very hard to get in dental school. And I don't think my grades back then would get me into dental school today, but fortunately it did. And I learned that I had no idea what I thought I was getting into, but there were certain aspects that I did end up liking. And dental school was a struggle for me. But when I got out, that's when what I found out is that you learn so little in dental school. Your real learning experiences after you get out. It's a never-ending journey. I graduated from dental school in 1977. And even to this day, even at this meeting, I'm still learning. I'm still picking up things and sitting in lectures or talking to people. And sometimes it's not even going to lecture. Sometimes it's a friend or a colleague, and you're just sitting there talking, and they'll tell you something, and you start sharing ideas, and you're learning. But it's a never-ending process of learning.
Yeah. So when you got out of dental school, how did you, because you, like, to your point, you graduate just like in dental hygiene. We graduate and we know all the latest stuff. For that entry level dentist or hygienist. But then how did you decide, or what was your way that you decided to engage in other future learning opportunities?
So that's a great question. For me, like I said, I didn't have a great experience in dental school, and I had no idea what I wanted to do. And I didn't feel I was real competent. In other words, I didn't feel like the general public, I was good enough and they were ready for me yet. I didn't want to, impose myself on them yet, because I didn't feel like my ability and my skills were there yet. So I went into the Army. I had a couple of friends in school that were going into the Army. So that's why, and they, you make a good living and you get to travel around. I was married, and I thought, well, this will be a good way to get, start off. What ended up happening, I got very lucky because I had a great experience, and I got to work with a lot of dentists. And I got to learn how to do dentistry, and they treated you with a lot of respect, and it made me feel good, and it made me want to learn more. And I got a lot better. My speed got better. My skill got better. And I met an endodontist, and he kind of took me under his wing, and he taught me how to do root canals. And I got pretty proficient at it working with him, and came out of the Army and wanted to be an endodontist. And I was pretty good at operative dentistry too, but really wanted to be an endodontist. And so I got out, and my grades weren't great in dental school, but I applied to the endo residency, And in the meantime, I was working as an associate. Long story short, I finally got accepted to endo. But by the time I did, I had 2 little children, 2 small girls, and I had kind of fallen in love with cosmetic dentistry. And I was doing a lot of dentistry and happy where I was. And dentist I was working with didn't want me to leave. And he made me a really good offer. So I decided not to do endo and basically went into restorative and cosmetic dentistry. But that's how it all started for me.
And it's wild because you couldn't have guessed it in 1,000 years what you might do.
No, I had no idea. And all I knew was I was getting into the Army because I felt like that was a good place to go to learn and to get better.
Yeah.
And but for me, it turned out being a blessing in disguise. And that was one of the major things. Well, there were basically 3 major things. 2 of them we've already said. One was realizing in school, if I was going to go into dentistry, I had to buckle down and make grades. That was the first thing. The second thing was getting into the Army and meeting people and actually finding out, hey, I can do this and I can be pretty good at this. And the third major thing in my life that changed everything around for me was taking a course. Because to be honest with you, Kelly, I'm out and I'm just, I'm in my little 4 walls doing my thing, doing what I considered to be pretty good dentistry. My patients were happy. I had a growing practice, a lot of referrals, a lot of people coming to see me and making a good living. And I thought everything was good, supporting my family and say, I guess I'm successful, but not really understanding that there was so much more out there. So I took this course, which I'm in, right outside of Birmingham, where the dental school that I went to, that's where it is. So I would go to the school to take CE. Well, the next thing I know, I'm signing up for this course and I have no idea what made me do it, because you have to bring a patient to the course. And you have to work on that patient and you learn anterior aesthetics or porcelain veneers, which I already was doing and already liked. And I thought I was pretty good. Well, I take this course and there's 2 dentists, Bill Dickerson and Larry Rosenthal, were teaching this course in Dallas, at Baylor Dental School in Dallas. And I was just blown away by how little I knew. And I thought I was a pretty good cosmetic dentist because I've been interested since I got out of dental school. So and I've been doing veneers already, but I couldn't even scratch the surface in what I was learning there and what I didn't know. And so that was a turning point for me. And I got to know Larry Rosenthal pretty well. And he asked me, after taking the 2 courses, they went their own ways. Bill was in Las Vegas and he started LVI, and Larry was from New York and he started his own program in New York called Aesthetic Advantage. And he asked me if I'd like to teach with him. And I said, yeah, absolutely. So that was the third major thing. And that was maybe the most, because that opened up a lot of doors for me. One, it made me understand that, you can be a pretty good dentist and you can do really good dentistry. But when you start teaching other dentists and you start having to tell them and answer their questions and show them, that is a scary thing. And the first time I ever taught a program, I was nervous, even though if it were me and I were doing it myself, I'd have no nerves at all.
Right.
But to teach another dentist. And so what that did is I said, okay, I'm going to start. I got to learn. And I started taking CE, just tons of CE. And so I had been taking CE, but, I wasn't really dedicated to it. So it was taking the CE and to learn so I could teach other dentists that really haven't learned. And then that led to lecturing. And so in his courses, we would get to lecture a little bit and do some lectures. And I was horrible starting out. But the more you do, the more comfortable you get doing it. And also, lecturing is great too, because you have to know your subject.
Yeah.
So I'm reading all the time. And it's a funny story where I'm on a plane with them. Every time I'm flying somewhere, especially when I'm teaching on the West Coast, it's a long flight. Excuse me. I'd have all my dental journals and I'm sitting next to the guy and I'm reading this article and the dentist, and he looks over at me and said, "So you're a dentist?" I said, "Yeah." And I said, "I bet my dentist probably doesn't read on dental magazines on the airplane." And I said, "Yeah, probably not." But I thought that was kind of funny. It kind of hit home to me because it was just, for me, it was just what I did.
Normal, yeah.
But to other people, that was probably seem weird that, that you'd be reading a dental magazine on an airplane, but I'm trying to learn, and I would use every opportunity to learn and to study, to take courses and to get better, because if I'm gonna stand up in front of a room, I feel like I need to know my subject. And so that was a major thing for me, and it's just grown ever since. I taught with Larry for over 10 years, tremendous learning experience for me. And not only was it was learning and it was fun. What I found out is that if something is fun, you're going to learn better and you're going to learn more when you have fun and you're enjoying it.
Absolutely.
So when I lecture or teach, I always try to keep it low key. I always try to make it fun. I always try to use humor and I want people to enjoy it, because in dental school, it wasn't fun. And it was harder for me, I think, because I wasn't enjoying it. I wasn't having a good time. But now all of a sudden we're doing these live patient hands-on courses, and we're in New York, we're in Palm Beach, we're in London, we're teaching in these places. And it was fun. It was fun traveling. So I'm just a little kid from Alabama, and all of a sudden, I'm in New York and I'm in West Palm Beach, and I'm flying over to London to teach over there, and where their teeth were horrible, and we were having a lot of fun over there doing cosmetic dentistry.
I bet you were.
So we had a really good time. And so all of a sudden, it's like I sometimes have to pinch myself. I'm going, wow, I can't believe, from where I was to this. And that's where we get in dentistry sometimes. You get in your little four walls, and you're in your own little element, but there's a whole other thing going on outside there.
So how do you shake the dentist and wake them up to say, there's so much more out there. We need to do something about it.
You're so right. And the way I try to do it is when I lecture, and I try to tell them, I said, and I always start off by saying, first thing I want to tell you is I'm no guru. I said, you're not going to see my name next to Gordon Christensen, or, they're not going to say, oh yeah, Tom Dudney. Oh yeah. You got to go hear him. But when I lecture, I said, I'm not, but what I do is I've had great mentors. I've learned from some giants in dentistry, and they were nice enough to me, and they were nice enough to share and impart their knowledge and wisdom with me. And I just try to give back. I just try to take what I've learned and share that with my audience, or with the people we're teaching. And we do it like I said, I want to be low key. And when we do our live patient programs, my attitude is always let the dentist have fun, build him up in front of his staff, make him look like a rock star, or her, the dentist taking your course. You want them to feel good and not put anybody down. And I say, oh, I can't believe you did that. You want them to think, wow, you did a great job, and make their patient feel like, wow, your dentist is really good. And use that as a way to motivate and inspire the dentist to want to learn and to want to get better. And hopefully in your lectures, you can show them things. I'm not like a fancy lecture. I'm a person, I like basic stuff. I like, like meat and potato stuff. I want my audience, I want them to sit there and say, oh, I could do that. Yeah. I don't want somebody listen, I look lectures and I look at them going, I'm not even sure I could do that. And I do a lot of this stuff. But I want everybody in the room sitting there to think, you know what, that looks pretty easy. I think I could do that. I want it to be. I believe in the KISS principle. I really want to keep things simple and basic.
Do you think that, one of your first things that you said about the experience that you had going to a CE is that you brought the patient?
Right.
Where do you recommend that to a dentist?
Absolutely.
Okay. And, because that can be intimidating too.
Very intimidating. And that's why it's so important for it to be a no ego, low key environment. And you make the dentist feel good. You assuage their fears. You make them, you get them comfortable by saying, listen, you do not need to worry. We're going to be right there with you. And that's what you do. You have people teaching right there chairside, and you're helping them. I said, if you have any questions, we'll be there for you. If you have any concerns, we'll be there for you. And so, and you want them to feel good, because you're absolutely correct. It is a little bit intimidating to bring a patient and to work in front of the people. Let me tell you, other dentists will come around, and I've been showing somebody something, and I'll look up and there'll be 10 or 15 people standing there all watching. So for a dentist to do that with other people watching him work, when you're in your little office, your assistant's the only person that sees you.
Right.
Yeah.
So, you feel very exposed.
Yeah,
right?
But now you're real exposed, because you look up and go, oh, look at all these people.
You feel like you're in dental school. You're like, I don't know if I'd do that.
Yeah, exactly. So yes, to answer your question, it was a little intimidating. And for me, I stepped way out of my comfort zone. And looking back on it now, I really can't believe I did it, except I felt like it was time to learn more. I felt like I was doing okay. But what I found out, and one of the things I learned, and Bill Dickerson, said that he'd heard it, but the saying that stuck with me is, you don't know what you don't know. And when I heard him say that, I went, oh my gosh, that is so true. But I'd never heard anybody say, you don't know what you don't know. And that's where we were. But there's two more parts to that. You don't know what you don't know. If you don't know what you don't know, you'll always do what you've always done. And if you always do what you've always done, you'll always get what you've always gotten. And that kind of was describing me. So it kind of, made me think like just that alone made it
You have to
worthwhile.
decide if you just want to be good enough.
Yes, exactly.
And if you just want to be good enough,
and that's
then that's okay too.
It is. I have no problem with that. But some people, you know, want to do more or want to be better, and they're not really sure how. And that's why it was such an eye-opening thing for me. But I will tell you, getting to teach and having the opportunity to teach and lecture is just another whole world of dentistry, because it made me stay on the cutting edge. And I'll use dental materials as an example, like adhesives and cements. You know, materials, adhesives, and cements, they change all the time. I could do my smile design lecture, and I'm using the same slides I used 20 years ago. If I tried to use my slides from 20 years ago for materials, they feel like they don't even know what I'm talking about, and they're not even in use anymore. They're changing so rapidly, so you really have to stay up with it. And it gets, the more there is, the more confusing it is, and dentists get really confused. What I do? Do I use universal adhesive? Do I use what cement do I use? When do I use the dual cure cement? When do I use light cure cement? When do I use a self-adhesive cement? So they have all these, they're not sure. So my goal when I do that lecture is to try to simplify it for them, to try to make them understand in a format that's easier to process. So that because there's so much information out there they don't know.
Well, and so that's why I think that for so many professionals, and when you're talking about dental materials just specifically, it's so hard to try to pry a product out of the dentist's hands that they've been used to using,
that they've been comfortable with.
So how do they get past that point of saying, I am going to try something new and I do feel comfortable?
That's a good question. And I think some of it boils down to their confidence in you. If they're confident in what you say, that, hey, you may be getting good results with that, but if you try this, you might end up liking it even better, because I know from personal experience, I had things that I liked and I thought it was pretty good and I was having success. You know, like when universal adhesives first came out, I was having no problems, no post-substitutivity, no debonds, no micro leakage with fifth generation adhesives. So I'm going, why would I want to change? But then when I converted over, it was a tremendous difference. And just like materials, I was resistant to zirconia when it first came out because it wasn't very aesthetic. We have zirconia today that is beautiful. You can't tell it from glass ceramics. You could put an Emax crown right next to a zirconia crown if it's a 5Y, you know, translucent type zirconia, and it is beautiful, just beautiful. So the materials change too, and they get better, and keeping and understanding that. So I've had things I swore I would never. I have a colleague, a friend, and he's still, a couple of years ago, I've talked to him, he's still doing PFMs. And I go, Jimmy, why would you want to do PFMs? He says, well, I have this lab guy and he's been doing for years and he's really good and they fit good. And I go, yeah, that's okay. But I said, you know, with zirconia now, they're milling them. It's fast, it's simple, it's easy, it's less expensive, and they look great in the mouth and they fit great too. So, but there's very predictable. But there are people, and they're easy to cement. But there are people that get set in their ways, and I understand that. And I'll even tell people, I said, listen, if you're happy and you're getting good results, fine. But if you ever have something you think, well, maybe it could be a little bit better, it might not be a bad idea to look into changing something. But yeah, it is a fine line you walk there between trying to convince somebody to change when they're happy with what they have.
Yeah, and I'm trying to think too, from a patient standpoint, they have no idea if the dentist is up on the latest and greatest. They just trust that you are, like to the point of you reading the journal on the plane. So it's our responsibility. You know,
we get a lot of credit sometimes. Okay, they just naturally assume you're a dentist, you must be pretty good. You know, because you wouldn't have a degree. So there is a lot of trust. And listen, to our profession's credit, a lot of that trust has been earned, because there's always going to be some bad apples. There's always, listen, I've seen a lot of dentistry that was reported on horrible. Okay, but for the most part, there's a lot of good dentistry out there. And when you do surveys, dentistry as a profession is very high on the trust scale. Okay, it is a profession that has a lot of trust, and a lot of that has been earned. But you're right, patients don't know. They don't know what you're using. They don't know if it's good or bad or indifferent. And so I think it's our job to care enough to want to do the best that you can do. And that's really, to me, what it boils down to. Do you love what you do enough? And people, like, I get asked this question a lot. When are you going to retire? You know, because, you know, once you get up there kind of, you know, and you're, you know, people know I'm getting old. They know I've been there a long time. They go, when are you going to retire? And I always ask them, I say, are you asking me because you think I should, or because you're hoping I don't, and they go, oh, no, I don't want you to retire,
Yeah.
And
yeah.
so, but I'm happy and I still love what I do. And I still get a lot of fulfillment out of maybe helping someone who is very insecure or very self-conscious about their smile or their appearance. And you can help somebody, give them a beautiful smile. You can change somebody's life. You can make them come out of a shell, have more self-esteem, feel more self-confident, change their appearance for the better, make them look younger. All these things are extremely rewarding to me. And I've had we just had a case last week, a cleft palate case. The kid's been going through treatments. He's 17 years old. He started when he was 6 years old. His whole life just about has been orthodontic surgery, treatments. And naturally, their teeth aren't going to look great. My orthodontist had gotten in a great position. But, when you give them a beautiful smile and you know what they've been through in their life, and their just face lights up and the parents' face lights up. And that's just a feeling you just don't get. I mean, it's a very rewarding feeling. So as long as I can do it, I tell them, I said, they'll probably have to wheel me out of my house because I don't know when I want to retire. I like what I'm doing.
I don't see how, you obviously have passion for what you do and the profession and the teaching aspect of the service on different levels.
Right.
And so I can't even imagine never doing what I do until the day I die.
I know, because you love what you do.
Yeah.
But see, the teaching, the combination for me, what I realized one day is I said, teaching and lecturing keeps me very knowledgeable for but doing dentistry chairside also allows me to use the products that I'm talking about. So I feel like I'm getting the best of both worlds. I'm actually using those products that I'm talking about, and I am learning and staying right on the cutting edge because I'm teaching and I have to keep learning. I have to stay knowledgeable. But you're getting back to what you said a minute ago about the patients. There are certain things they do notice. They notice cleanliness. They notice how you treat, like I have a great relationship with my chairside assistant. And I think they want that. I think they want you to be comfortable and kind. And I would never, ever say a cross word, in front of a patient. I think they would like that. I think they want to know you have a good relationship. She's been with me for almost 39 years now.
Wow.
And she is so proficient and so savvy as an assistant that we can do a whole procedure without ever saying a word to each other. And patients will say, sometimes say, it was like watching a symphony. So he said, all these things are going on and you never say a word. And to me said, you remind me of a race car pit crew or something, because you're moving like this. So we get all these things. But a lot of it is you're working together and knowing each other and never having to say anything because she knows exactly what I'm going to do. And sometimes she reminds me if I forget. So it's nice having that safety blanket. But one other thing that patients do know is technology too. And we live in a technology age now, and they'll know if you're using lasers or if you're using things, or like we've been using Pearl in our office, which is artificial intelligence. Yes. So we have AI in our office and we can see things that the naked eye can't on an x-ray. So it's going to bring stuff up that you may not notice otherwise. But there's, we're scanning now for our impressions. We have 3D technology with our CBCT. So all of these things patients notice, especially if they come from another office where they didn't get any of that. So, and then I think
they expect it.
Yes. And then I think the other thing is how you treat patients, how kind you are, how welcome you make them feel. I learned so much from teaching with Larry because he's in Manhattan. He has people come literally all over the world, certainly all over the country, to come to see him in New York. But the first time I heard somebody say 5-star product, 5-star service. So in fact, his front desk person, he put a little thing like in 5-star hotels, it says concierge. He didn't call him a front desk person. He called it a concierge. So, and he started that philosophy of how you have to treat your patients the same way you'd be treated if you went into a Ritz-Carlton hotel or something like that.
Without them, you aren't in business.
No. And so people like coming to us, we want them to feel like family, want them to feel like part of us. Another example would be a new patient comes in, and we used to, I don't have to tell them anymore, but for years I'd have to tell them, if you see at 9 o'clock, you have a new patient coming in, you know their name, it's on your schedule, and somebody walks in the door and you don't recognize them, it's probably that person. Get up, go around and greet them by name and welcome them into your practice. It's little things. It's just amazing how much little things can be accepted and appreciated. Call them by name. People like to hear their name. Treat them like you would a member of your family. And our office is our home, and it's like you are having a guest in your home.
Yeah, yeah.
You want to be that way. So there's a lot of little things that you're right when you say patients don't know, but there's things that they do know and they do recognize. It's how you treat them. Yeah, totally correct.
Yeah, we got to slow down a little bit and go back to the basics.
Oh yeah,
I think with that human touch, because that's one thing that AI will never replace.
No, it can't.
Is that personal.
Or any technology?
Yes,
will never replace the human touch, and it's so critical for, at least for me, because a lot of people don't think of the dental field as something like that. They think it's cold, it's sterile, it's uncaring, unfeeling. You just go about your job and you just do your job. You try to do quality work.
We're being harassed in the podcast area. This is fun.
I know.
This is part of the live.
These are all my friends. They're walking by. And so anyway, but I could not agree more. But as we go further in, I don't think you're ever going to lose what people like, in addition to good dentistry. Of course it's not a substitute for bad dentistry. Don't get me wrong. Just if you treat them nice or treat them like family and you're not a very good dentist, you have to be a competent dentist and you have to do quality dentistry, and they don't like to be hurt. I have a thing that I learned how to do years ago, is to give a painless shot. It's amazing to me what a big deal that is to patients. They go, oh my gosh, I didn't even feel that. And it just blows them away. And they'll say, oh, I love your shots. Oh, you never heard, So those little things like that, it shows you care. I said, yeah, we don't believe that shots should be painful. We believe that's the way to do it. Knowing that that you care enough about them that you don't want them to have a bad experience. They appreciate that.
Yeah.
And I think that we see a lot of it in a lot of offices. It was a big thing years ago, and we kind of gotten out of it. You still see it in some areas, like boutique practices and spa, they call spa dentistry, where they go the extra mile. They try to make their dental experience for their patient like it would be a spa. Paraffin wax treatments for the hands, back massagers. I've heard of dentists that do have somebody come in to do a foot massage or something.
Oh yeah, it's the whole thing.
Anything just to give them a feeling that they're getting something other than just dental treatment. That this is
the old buff and wax.
Because listen, you're never ever going to hear somebody say, oh God, I got to go to the spa today. Oh God, I got a spa appointment. They're never going to say, oh, and they, like women are famous for never wanting to break their nail appointment.
No, we will not.
For their nails. Their manicure is always, or their hair manicures, they always at the top of the list. Dental appointments are a little bit down.
Do us part,
So we want to try to get the dental appointment where you would think like a spa appointment. You never get up and say, oh God, I got to go to the dentist today. You never get to go, oh, I got to go to the spa today. So if you could somehow get it to be where it's a little bit closer, or do some little things where people actually look forward to it. And if you make people feel good or do something about their day, it's why we try to remember things about them and their family. And I always try to say, when a husband and wife are patients, I always try to say, hey, tell Joe we said hey, or tell the wife, call the wife's name. So that not just their name, but their wife or their husband's name too, or their children.
Like family. Tell so-and-so.
Ask about them. Just like you would your family, or just like your best friends. You're going to ask about them. You're going to say, hey, how's it going? Or how's so-and-so? How's your wife doing? That's the kind of environment we try to foster. We want to have that experience where the patients feel like they're getting more than just dentistry. Yeah. But
they are. So mentoring, being uncomfortable, going outside of your comfort zone.
Yes.
Patient first. Concierge service.
Yes. All those things.
All of these things.
Here's the thing I've learned, and I've had a lot of years of experience, that going out of your comfort zone is difficult. But once you do it and you get out there, it becomes a lot more comfortable.
Yes.
It's the first step. It's just it's like you asked me earlier about that. Wasn't that course where you had to bring a patient for the first time you'd ever done that? Wasn't that nerve-wracking? I said, yes. I had never had anybody watch me work other than my office staff. So that was, but once I did and got out of my comfort zone and got proud of myself for doing it, it became easier. The first time I taught a dentist chair side, I was a nervous wreck. The first time I got in front of a room and lectured, I was a nervous wreck. I couldn't remember anything. You know, I talk fast anyway. People can't believe I'm from Alabama because I speak fast. I've had people come up in lectures and say, well, you really talk fast. You sound like you're from New York. But but when I did that lecture, I was like speed talking.
Yeah.
You know, it's like, because I was nervous.
Yeah.
And I was, you know, so the first time you do anything, you're uncomfortable, but as you do things more and more, you're going to get more comfortable with it.
And it's all about the first step, you guys. And we talk a lot about that in the episode. Dr. Dudney, it has been absolute pleasure
Mine as well.
having you on.
Thank you, Kelly.
Thank you so much for your expertise.
Well, I don't know about
insight.
Expertise, but
I mean, it's your lived human experience,
and
right?
I'm passionate about it. I love it, and I never have a problem talking about it because I really do love this.
Yeah,
and I love the fact of what you're doing and taking the time to do this and get that word out there like you are. So real credit to our profession. I've enjoyed being with you today.
Thank you. Likewise. All right. And for anybody who wants to get in touch with Dr. Dudney, his information is in the show notes. And you guys know I always ask the favor. Go on over to Apple Podcasts, give me 5 stars, give the Dental Handoff 5 stars.
She's worth 5 stars.
Thank you. And then go on over to YouTube, like, subscribe, share to all your friends. My friends, thank you so much for what you do every day. With love, I'll see you next time. Be well.